system? So many people believe this. They drink crushed garlic mixed with honey and water in the morning, add raw garlic to their salad for lunch, and have a few roasted garlic cloves with soju for dinner. Some even take black garlic extract capsules every day, believing that more is better. Does this sound strange? Maybe you or your family do this too. But lately, have you been feeling tired even after getting enough sleep? Or waking up with slightly open eyes? Or with clear sock? Have you ever heard that eating garlic every day detoxifies, prevents cancer, and protects the cardiovascular marks on your ankles? Or even less urine output? If so, don't just assume it's your age or salty foods. Sometimes, what you thought was healthy could be quietly damaging your kidneys. Garlic is a wonderful food. There's no denying it. Garlic contains a compound called allicin, which has antibacterial, anti-inflammatory, and blood circulation boosting properties. However, if combined incorrectly or consumed in excess, allicin can cause oxidative stress on kidney cells. The kidneys are the most silently working organs in the body. They filter over 180 million gallons of blood every day, eliminating toxins and leaving behind pure ingredients that keep us alive. If you think of the body as a city, the kidneys are like a groundwater treatment plant, working silently day and night. If that plant becomes partially clogged, waste products aren't properly eliminated, and your blood begins to become polluted. Many people think garlic is safe because it's a folk remedy. But science tells us that there's an optimal amount for every active ingredient. Overuse or improper mixing can cause inflammation within the kidneys, raise liver enzymes, and lower blood pressure. The most dangerous thing is that you might not feel sick at all. You may not have a fever or any noticeable symptoms. By the time you get tested, your creatinine levels are elevated and protein starts leaking into your urine. It may be too late. If you think you're strengthening your kidneys by eating raw garlic with fish or seafood, drinking garlic incantations, or eating black garlic with ginseng, stop and listen. These very combinations are one of the reasons why the rate of mild kidney inflammation has increased rapidly among middle-aged Koreans over the past 5 years, according to statistics from the Korean Society of Nephrology. Part of the reason is the misuse of garlic in traditional diets. Many people believe garlic expels toxins, but in fact, garlic can cause kidneys to overload their tolerance. Imagine your kidneys as a thin filter, allowing only tiny, microscopic molecules to pass through. However, if you eat excessive amounts of raw garlic daily or consume it with alcohol, allicin levels rise, triggering an oxidation reaction that generates free radicals. These free radicals bind to the cells, thickening them and causing them to lose elasticity. This causes proteins that should remain in the blood to leak into the urine. Many people think that slightly foamy, white urine is okay, but that's not true. It's a sign that the kidneys are becoming worn out. The problem isn't that you're eating garlic. It's what foods you're consuming it with and how much. When garlic combines with high-protein, purine-rich foods like red meat, organ meats, or seafood, it stimulates the production of uric acid nitrate, which can lead to kidney stones and interstitial inflammation. When garlic is consumed with alcohol, allicin is transformed into a substance called methyl cap, which can inflame the kidney lining. And if you take garlic with ginseng or kidney tonics, blood flow to the kidneys suddenly increases, almost like your old liver is being revved up. The result? Your kidneys swell, become slightly inflamed, and gradually fibrosed. If you think you're young and everything will be fine, remember, your kidneys don't send pain signals. They just talk to you in subtle ways. You might wake up with slightly puffy eyes, your skin might feel flabby, or you might wake up 2 or 3 times a night to urinate. And many of those people have come to me too late, to the point where they need 3 times a week hemodialysis for the rest of their lives. Not one of them thought garlic was the problem. But the good news is, you can still reap the benefits of garlic without causing harm. With a few small adjustments, garlic can still be a miracle drug when used properly. Cook them appropriately. Eat them with rice or vegetables, and avoid eating them with alcohol or raw foods. Limit yourself to 1 or 2 cloves a day. More importantly, understand your current condition. If you already have an underlying condition or are taking medication, don't try to supplement with high doses of garlic. Today, I'll help you understand better why we still think garlic is good for you, how garlic can harm your kidneys, the most dangerous combinations that can turn garlic toxic, and how to eat garlic safely and scientifically while protecting your kidneys and circulatory system. If you found this topic helpful, please subscribe to my channel and leave a comment to continue sharing this topic. One small change, starting today, can help you or your family avoid years of kidney-related fatigue. My name is Yuho Jin. I'm an internal medicine specialist with over 30 years of experience, currently working at a university hospital. I see a lot of patients late in life. They believe it was okay because it was a natural diet. And there are also people who listened to me, understood their bodies, and reversed their kidney problems without medication. I want you to be the second person, not the first. Because sometimes what we believe to be healthy is actually silently harming the kidneys, the most important organ in our bodies. When I say that garlic, if used incorrectly, can harm the kidneys, many people are immediately surprised. Some even object. Garlic is good, isn't it? Doctor, our family has been eating it our whole lives. What's the problem? I understand that feeling. Because garlic has been considered a magical medicine in East Asian cultures for thousands of years. However, when people overly trust this very natural medicine, many are unknowingly causing dangerous chemical reactions in their bodies. One spring morning, I met Mr. Park Sung-ho, a 54-year-old businessman. He looked tired from the moment he entered the clinic, his eyes slightly closed, and his hands seemed to shake. Tests revealed his creatine levels were abnormally high, meaning his kidney function had dropped by nearly 40%. I asked him about his eating habits. He confidently answered, "Doctor, I take great care of my health. I eat raw garlic with honey every morning, seafood for lunch, and a warm glass of soju for dinner. I heard it was very good for me." I watched him in silence. Those 3 habits, while supposedly for health reasons, were actually having a devastating effect on his kidneys. The first was eating raw garlic and seafood together. Seafood, especially clams, shrimp, and squid, are rich in selenium, zinc, and trace metals. These substances are beneficial when properly metabolized, but when combined with the allicin in raw garlic, they can form compounds like selenium and sulfide. These compounds are not easily dissolved and can easily be deposited in the urine of the kidneys. If they accumulate for a long time, the renal tubules become slightly inflamed, as if a thick layer of sediment has formed in the pipes. Initially, there are no particular symptoms. However, over several months, blood flow to the kidneys gradually decreases, gradually deteriorating their function. A 2020 study published in the Korean Journal of Nephrology found that people who consumed raw garlic and seafood at least once a week had a 30% higher risk of premature kidney failure than those who did not. The second factor was eating garlic with alcohol. In Korea, it is common to soak garlic in soju or makgeolli and drink it as garlic wine. This is said to improve blood circulation, warm the body, and prevent colds. However, when ethanol and alcohol mixes with the allicin in raw garlic, a highly irritating substance called allomertin can be created. Once absorbed, this substance travels directly to the liver and kidneys, triggering an inflammatory response in the kidneys and constricting the small blood vessels within them. As a result, clotting rapidly increases, causing microscopic damage to glomerular cells. While no immediate symptoms are apparent, symptoms such as slight weight gain, decreased urine output, and persistent foaming may begin a few months later. These are early signs of renal interstitial inflammation. I once treated a woman in her early 40s who drank half a glass of garlic tea every day. 3 years later, her kidney function was only at 55%. She said, "I don't smoke, I don't drink beer, and I just ate garlic." Yes, that's right. But that garlic alone made her kidneys work twice as hard. Third, and what almost no one expects, is the combination of garlic with ginseng or kidney tonics. Many people think that eating these two together is good, thinking that since both are good, adding more would be even better. However, both garlic and ginseng have the effect of dilating blood vessels and stimulating blood circulation. When these two are combined, blood flow to the kidneys suddenly increases. However, The small blood vessels in the kidneys are very fine and fragile. Excessive blood flow can easily cause the vessel walls to rupture, causing microscopic proteins to leak out. Repeatedly, this can lead to glomerular fibrosis and scarring. This is irreversible damage. I always tell my patients with high blood pressure, you're giving your kidneys high-intensity exercise every day. Don't stop. He smiled awkwardly and said, I just wanted to get better quickly. Yes, but the body needs to do it right, not fast. Some people eat raw garlic with red meat or organ meat. People believe that garlic helps break down fat. In fact, allicin helps break down fat in meat. When combined with purines, xanthine activates the enzyme citrin oxidase, a component of the xanthine family. This increases the production of uric acid. Urine not only causes gout, but can also crystallize in the kidneys, forming stones. A single stone can block the urinary tract, causing severe pain and widespread inflammation. Many patients who come to me say, I probably just have one small stone, but when they get an ultrasound, one of their kidneys is almost atrophied. This is due to chronic inflammation. The human body has incredible endurance, but every organ has its limits, especially the kidneys. Forcing them to filter out more compounds that they can't handle every day is like forcing them to run a marathon every day without rest. At first, they can handle it, but then, suddenly, they collapse and can't get up. The kidneys are no different. When it's broken, there's no way to get it back to how it was before. I always tell my patients, garlic is your friend, unless you make it into a medicine. Garlic should be a seasoning, not a medicine. If you cook it properly, eat it with rice or vegetables, and avoid the 3 taboos. Raw vegetables, ginseng, or supplements. Your kidneys will be protected. On the other hand, if you eat garlic in boosted doses every day, you're harming one of the most faithful organs in your body. I once met a 72-year-old man in Busan. He said quietly, gently like the sea breeze, I thought garlic would prolong my life. But now I just hope my kidneys live with me for a few more years. That left me speechless for a while, because I know there's nothing sadder than ruining your health with the very thing you believe is medicine. So, if you're listening right now, after today's meal, stop for a moment. Reflect. What did you eat garlic with? Was it seafood, alcohol, ginseng, or supplements? A small change starting tomorrow, returning your garlic to its original state. This seasoning, not a magic potion, can save your kidneys from years of silent damage. My name is Yuho Jin. I'm not against garlic. I just want you to understand it and eat it. Because in medicine, everything has 2 sides, and how you use it determines whether it's medicine or poison. When I say that garlic can be harmful to the kidneys if misused, many people ask, so, doctor, is garlic medicine or poison? My answer is always the same. It can be medicine or poison, depending on how you use it. To understand that, we must first understand how the kidneys work. The kidneys have over 1 million microscopic filtration systems called nephrons. Each nephron is like a thin mesh, filtering out toxins while retaining proteins, blood, and essential minerals. In a healthy person, the kidneys filter approximately 180 milliliters of blood each day, removing toxins and returning the purified portion to the body. In other words, everything you eat, drink, or breathe passes through the kidneys at least once. Garlic, when used in moderation, can enhance this process. Allicin, the main active ingredient in garlic, has anti-inflammatory, cholesterol-lowering, and blood circulation-enhancing effects. When garlic is lightly cooked, allicin transforms into a gene. This form is more stable, has antibacterial properties, and protects kidney blood vessels in conditions of high blood sugar or high blood pressure. This is why several clinical studies have shown that garlic can lower mild blood pressure and improve circulatory function in healthy people. However, the problem begins when garlic is consumed in doses exceeding this safe range. A small clove of garlic naturally contains about 2 to 3 milligrams of allicin. If you eat 56 cloves of raw garlic or take black garlic extract capsules daily, the total allicin intake can increase 15-fold. At that level, RC no longer acts as an antioxidant, but instead becomes a strong oxidizer, which can cause microinflammation of the glomerular filtration membrane. This reaction produces free radicals, unstable molecules that act like tiny sparks in the blood. When the body doesn't get enough antioxidants like vitamin C, E, or glutathione, these free radicals attack kidney cell membranes, causing them to thicken, harden, and lose their natural, refined filtration ability. The body then tries to excrete the remaining allicin through urine, but because there's so much, the kidney tubules have to work twice as hard as usual. This can result in decreased urine output, darker urine color, or persistent foaminess. Medically, this condition is called interstitial kidney disease, a painless but silent damage that gradually reduces the kidney's filtration function. If this continues, it can lead to glomerulosclerosis, where the filtering tissue is replaced by scar tissue. This scar tissue can no longer filter. Once sclerosing occurs, the kidneys never return to their previous state. The problem isn't just allicin. The wrong combination can be truly dangerous. When garlic is consumed with alcohol, ethanol converts allicin to allyl disulfide, which stimulates the liver's CYP450 enzyme, accelerating drug metabolism while simultaneously producing acetaldehyde sicoxide, which is toxic to the liver and kidneys. Eating garlic with protein or meats high in purines can further increase this process, leading to kidney stones and chronic kidney disease. It all starts with a meal that's considered nutritious. Another little known fact is that garlic can affect blood flow to the kidneys. For people with low blood pressure or taking blood pressure medication, high doses of garlic can cause excessive blood pressure drops. This results in insufficient blood flow to the kidneys. The kidneys function like a watermill. If the flow is weak, it won't turn and waste products will accumulate. Even if blood pressure drops to 15-20 m, glomerular filtration rate can drop by up to 25%. If this condition persists daily, the kidneys will require rest earlier than expected. I'm looking at a study conducted by the Korea Institute of Nutrition and Dietetics in 2021. In a group that consumed 6 or more cloves of raw garlic daily for 8 weeks, the average creatinine level rose by 15% and the GFR decreased by 10%. Interestingly, the group that consumed moderately cooked garlic, about 2 cloves per day, showed a slight improvement in inflammatory markers. This proves a simple but important fact. Cooking method determines everything. Science doesn't deny the value of garlic, but it does state clearly that frequent consumption of raw garlic increases the risk of mucosal irritation and kidney irritation. Moderate cooking reduces oxidative toxicity and increases safe absorption. Consuming it with alcohol, raw foods, ginseng, or supplements increases the burden on the kidneys and liver. Therefore, for garlic to truly be a medicine, it shouldn't be used as a daily pill, but as a small seasoning to your meals. Every organ in our body has the ability to heal itself if we don't continually damage it. And the kidneys, more than any other organ, need adequate rest. Now, I'll teach you how to use garlic properly, including recommended dosages, intake times, and safe food combinations. The benefits of garlic are about maintaining it without irritating your kidneys. Remember, good doesn't always mean too much, and balance is the only key to true health. Now, you understand why garlic, while good, can be harmful if misused. So, the most important question is, how can you eat garlic while still benefiting from it and protecting your kidneys? I always tell my patients, garlic is a seasoning, not a medicine. If you take garlic every day, like a medicine, you'll put more strain on your body than necessary. However, if you incorporate garlic into a balanced diet, your kidneys will function more reliably and more reliably. First, remember, small, consistent, and well-cooked garlic is key. Cooking garlic properly at 180 degrees Celsius retains its beneficial properties while converting the potentially irritating allicin into a milder form, allowing your body to safely absorb it. 1 or 2 cloves a day is sufficient. If you prefer the garlic flavor, try adding it to olive oil, vegetables, or legumes. The vegetable fats help neutralize any remaining oxidation. Second, never consume garlic with alcohol, raw vegetables, or ginseng. These are the 3 conflicting risks I mentioned earlier. If you want to eat seafood, wait at least 6 hours after eating garlic. If you drink alcohol, It's best to avoid garlic that day. And if you're taking supplements or ginseng water, be sure to consult your doctor before adding garlic to your diet. That simple delay can protect your kidneys from thousands of small reactions. Third, listen to your body signals. If you feel hot after a meal, have dark urine, or have low urine output, your kidneys may be overworked. Drink warm water, rest, and stop eating garlic for a while. Your body is always sending you signals. We just don't listen because we're too busy. I have a patient, Ms. Kim Hygiene. She was 62 years old. She believed that drinking garlic-infused wine every morning would help her live a long and disease-free life. But 2 years later, tests showed her kidney function had dropped by nearly 30%. She was shocked because she believed she was eating healthy. We cut out the garlic, instead eating roasted garlic, adding vegetables, and making sure she drank plenty of water every day. After 3 months, her indicators returned to normal, her skin brightened, and her puffiness disappeared. She told me, "It turns out that health isn't about